Welcome back to the Mom2Mom Podcast. Today we are talking about something that almost every pregnant person encounters at some point, and that is cervical checks. They are one of the most common parts of pregnancy and birth care. They're offered routinely, sometimes automatically, and sadly, sometimes without any explanation.
So right from the start, we want to be very clear about something. Cervical checks are optional.
Absolutely. And that doesn't mean that they're always bad. And it doesn't mean that they're never useful. It just means that you always have a choice.
So in this episode, you will hear us talk about cervical checks during pregnancy and labor, what they are, what information they do and don't give, when they might be helpful, and why consent should always be a part of the conversation.
Absolutely. This episode is not about fear. It's about informed decision-making, comfort, and respect. So let's get started. You are listening to the Mom2Mom Podcast, hosted by Stephanie Sinclair and Nikki Zwaber, partners and lead doulas here at How2Mom.
We're moms, we're professionals, and we're here to make motherhood feel a little less heavy and far more supported.
How2Mom is a community built for real life. From pregnancy and birth to postpartum and beyond, we support families through education, connection, and care. Our team of birth and postpartum doulas work with families every day while also sharing stories on our podcast and our blog to curate trusted resources for moms in the Twin Cities and beyond.
On this podcast, we talk about the real stuff, the stories that stay with you, the questions you're already asking, and the moments that feel hard, hopeful, and everything in between.
Absolutely. You will hear honest conversations, expert insight, lived experiences, and reminders that you are not doing this alone.
This is Mom2Mom. We're so glad you're here. And now, on to today's episode. All right, well, since we talked about it, information and what the cervical check actually tells us.
Yeah.
I mean, what does it actually tell us? Let's start with, I guess, like basics. Like, what are we assessing? Like, what's happening?
What are we looking for?
Yeah.
And oftentimes, if you've never had a cervical check, just to give you a little bit of context, in the office space setting and even in the hospital space setting, it will kind of feel like a pap smear,
Right.
Essentially, kind of like the position that you will be placed in. Your nurse or your provider will be inserting their fingers into your vagina to feel the cervix and to assess if there's dilation, if there's effacement, meaning has that cervix started to thin. They also can tell us, is that cervix posterior or is it starting to make its way anterior? But what I would say is probably one of the most important data points if we are doing a cervical check is, where's baby?
Right.
Over all of the other data points.
Right. Where's baby, and what word they use to describe where's baby is station. I mean, in the doula world, like there's really three pieces of information that we typically want to know from clients, especially while we're planning to join them, right? Dilation, okay, we're going to talk about that. Effacement, like you said, how thin the cervix is, and then station, which means essentially how high or low is baby in the process of labor.
Yeah, which can be, I would argue, one of the most important points for
100%.
sure. But I think what, Nikki kind of mentioned in the intro, what is even more important than like what a cervical check tells us is what a cervical check does not predict, which is, I think, a huge misconception, especially for those who really have only had conversations with their providers about this subject. Cervical checks do not predict when your labor will start. And they also are not an indicator of like how long your labor will be.
Right. And just a quick reminder, when you are having your cervix checked, that's for the dilation, which means that's measured in centimeters.
Yep.
So as a reminder for everybody out there, what we're doing. And when we get that information, that number of dilation, that, to Steph's point, that does not mean you're in labor, that not all the time, that doesn't mean that labor is starting, that we can predict when labor is going to start. It is a piece of information to be considered along with everything else to make decisions.
And it's not linear. And just to kind of go back of how it's measured, your cervix will start closed posterior. And that intention is so that you hold your baby in utero to continue to grow before labor starts. So it prevents our body from miscarrying. So during the process of our body preparing for labor, which can take weeks, that cervix will slowly start to move anterior and then start to thin and start to open. But the dilation number, or kind of what we're looking at, is that cervix going from 0 to 10, which is when we potentially could be entering the next phase of labor, which would be pushing. And so that's kind of the number system when measuring your cervix in dilation. Of that thinning is a percentage. And so when your cervix is thick, it is 0% effaced. When it's halfway thinned, it's about 50% effaced. And when it's completely thin, like paper thin, that would be considered 100% effaced. And so those are kind of the measurements. But I think it's so important to just really lean into the fact of, you can go to your provider and you can have a cervical check that day and be closed and thick, meaning your cervix is not showing any signs in terms of just those data points, and you can enter labor that night. You can also be a mom who is sitting at 2 centimeters dilated for weeks, if not more, before labor begins. And so that's what's really important, is it's just one part of the puzzle. It really doesn't, it's not super reliable information.
Yeah, it's just that snapshot in that moment in time.
Yep. Absolutely. So we kind of talked a little bit more about the numbers and what we're looking for while we're in labor, but let's talk about cervical checks during pregnancy. Like, first of all, why are they even offered in the first place? Because we just said they don't really give us a lot of information. And kind of when do they start to become like offered? And I think too, where Nikki and I get a little bit frustrated as doulas is sometimes our clients will talk about maybe their experience or a friend's experience where it's just routine to start having your cervix checked at 36 weeks. And we just want to let you know that if that's something you desire and you want, and after gathering information, you're consenting to that, that's like, that is your call. That's your option. However, it is not necessary, and it should always be asked and discussed versus, having your strep B test done at 36 weeks and your doctor saying, well, I'm already down here, so I'm going to go ahead and check your cervix. And we're like, excuse me, is that a question? And oftentimes people don't know that doesn't have to be routine.
Right. And I think it happens to everybody. I mean, regardless, it doesn't just apply to pregnancy, but I think it's heightened. If someone is giving you an option for convenience, but it's sort of shrouded in
this is routine,
non-consent, I think that's also something to be aware of moving forward just with life, right? Like it may be shrouded in convenience, but it's really not asking for consent. And so you still have the right to ask for consent.
Yeah. And this is a really great time in your pregnancy to start advocating, right? In those visits to say, yes, I am interested in a cervical check, but here's what I want to know from that cervical check. Or, yes, I want a cervical check, but I don't want any information. I just want you to be in the know about the data. Or, nope, there's no need, whether this is, just protocol or procedure that you often offer. That doesn't mean that as your patient, I am wanting that. And I think there's a lot of reasons behind that we need to talk about. But first I want to say, like, just because you decline a cervical check does not mean you're declining care.
Correct.
And if your provider is making you feel that way, that is a red flag.
That is a provider red flag.
Yeah.
Absolutely.
You should never feel coerced into
Mhm.
that. You should never be made to feel an inconvenience or an annoyance. Like, this is your body. And I think too, why we talk to our clients and we really ask them questions to help them figure out if this is a good option for them or not is because it physically can be a really big game,
Yeah.
but also emotionally and mentally. So, for example, if you go in for your 36-week visit, we would anticipate that your cervix is going to be thick and closed.
Yes.
We still want your baby in utero growing and thriving and not really preparing to be delivered yet.
Yeah.
And so that cervical check, especially with a cervix that is posterior, and especially for the first time having fingers in your vagina that's not for pleasure, can be extremely uncomfortable.
Mhm.
And there can be a lot of tension within your body during that check. And some women will leave that doctor visit and go, oh my gosh, that was so painful. How am I ever going to be able to handle labor?
Mhm.
Or if they're told, oh, your cervix is thick and closed, they're going, oh my gosh, I'm so worried. I'm not going to go into labor.
Yes.
So just so much mental, yeah.
Yeah.
But
We'll dig into that a little bit more.
there's a lot to be said about those like pregnancy cervical checks and whether or not they just align and are the right choice for you.
Yeah, I agree. I think it makes the most sense too now to move into cervical checks during the labor process.
Yep.
Cervical checks during labor can be clinically useful.
Yep.
They can be useful for, again, all this is just gathering information.
Yep.
This is not guaranteeing that you are moving on to the next step within an X amount of minutes or hours or days, right? Like, so it's really just information gathering.
Yep.
And I think if there are concerns about progress of labor, or, this is going to help us make a decision on in potential augmentation or intervention, right? Like, I think that those are great opportunities to gather that information, but then again, put that in the box of your informed consent.
Yeah, absolutely. And I think too, if we have a client who's really unsure where they land, like, I don't know, would I want that information? Would I not want that information? We really try and break down like personality traits,
Absolutely,
right? Like, are you a need to know person? Like, would that be helpful? Or would that potentially be harmful in terms of like keeping your mental capacity going in labor, right? Like, if you feel like I am actively laboring and I am putting in a ton of work and I get news that I'm 2 centimeters, is that going to make me like throw in the towel? And so, kind of, if somebody's unsure, even after the conversation of breaking down, like, well, what is your personality traits like? Like, what do you prefer? And they're still unsure. We kind of give this peace of mind of like, that would be helpful if we're needing to make a decision, needing to potentially change something. But if we are doing well and we're coping well, and that data and that information isn't going to change what we're doing, it doesn't seem helpful or useful. And that would probably be a time that a cervical check would be unnecessary. We also have clients too that if that data would be helpful for your team, but you know that mentally that would mess with kind of your focus, we can still, consent to a cervical check, but only have that staff member inform your significant other or your doula or your support team so that we can make decisions, especially as doulas, when we focus a lot on fetal positioning. That information can be helpful in terms of what positions we recommend, what techniques we recommend. And so you can gather that data without getting the information yourself, but rather having your support team have the data to help guide.
Right. Yeah. I mean, I've had clients too where we've done that plan and then we've changed positions or we've done things. And I mean, know thyself. I'm a big know thyself person. And so when we're doing that, the client looks at me and goes, I didn't progress today. So I'm just normalizing it because no matter what decision you make, like,
you can always pivot.
But also like just be gentle with yourself. The mental part of every step of labor is a ton of work. So just keep that in mind when you're making decisions based on what you would normally feel like in a situation, getting that information.
Well, and progress is progress. Like if we get a cervical check and maybe we haven't progressed in dilation, but we're thinner, like that is still progress. And so really having the people surrounding you who are encouraging, who are reminding you that labor is not measured by only one data point. And so that reminder of like, you're doing work, you are making progress. There's so many different pieces of the puzzle that need to come together. If your baby's lower, if you're more effaced, like all of that is progress. I always kind of laugh because I am such a nosy Nelly that I could never know that people in the room had information that I didn't have.
No.
It would drive me nuts. But I've had clients who are so strong in that. And of course, like say, for example, you're like, I only want to know if I'm 5 centimeters dilated or more.
Right.
And we don't tell you. You obviously know you're not 5 or more, but you don't know if you're 1 or if you're 4. So it still helps kind of sustain your mental capacity. If that's aligns with kind of your personality traits. I think it's good to mention too, if you are giving birth in a hospital, they will say standard protocol is that your waters either need to be released, meaning they do a swab and they test for amniotic fluid, or you have to be in active labor to be admitted into the hospital. So for some people, that means I'm going to have a cervical check regardless, and I don't want to. I will say it's one of the harder points to advocate, but that you can. We have been with clients who have never had a cervical check. There are other ways for them to assess if you are in active labor or not. It might be longer time in triage, but you can absolutely advocate for not doing a routine cervical check at admittance. It's just a little bit harder.
We're interrupting this episode to ask, are you pregnant and drowning in information?
Hospital birth, home birth, epidural, no epidural, everyone has an opinion, but yours is the one that truly matters.
That's why How2Mom created our childbirth education course.
This isn't about telling you what to choose. It's about giving you the knowledge to make decisions that feel right for you.
Led by experienced professionals, our class covers the full picture: labor, birth, comfort measures, partner support, and postpartum, without judgment, pressure, or fear.
If you want to feel informed, confident, and supported heading into your birth, this class is for you. And remember, if you're a How2Mom doula client, make sure to enter your discount code at checkout.
Head to how2mom.com to learn more information about our courses, because informed moms feel different walking into birth. And now, back to the episode. Can I tell you a secret that I tell my clients?
Yes, tell me.
When I'm meeting with them for the first time or two.
Is it off the record?
I mean, it's not off the record, but like I legit.
Not anymore.
Not anymore. So it's really out there. But like I literally tell my clients, I don't care what you're dilated.
No, exactly.
I really don't. That for me, in the 3 things that have to line up perfectly: effacement, dilation, and station. Dilation is number 3 for me.
100%.
Like I don't care. Like you're going to dilate. I would rather focus on the other 2 pieces. And so again, like I love that we're talking about dilation, because I do, of course, it's important. But it's one snapshot of what needs to kind of all get into alignment to bring baby earthside, right? So I love that we're talking about it. I love that we're sort of almost debunking it a little bit.
Well, because if you were to ask just any random pregnant person, more often than not, they only know about dilation. Like our society only focuses on that one piece of data. A lot of times people don't even know what effacement is or how it plays a role.
No, and it's this like rush to get to 10, like a marathon to hit number 10, right? It's like, well, I mean, yeah, obviously we have to get there to safely push.
Yes. But I think we are debunking. Like that is not. And then what about too, even as doulas, we'll say like, did you ask the nurse what station? Oh, baby's really low. Okay, I love that feedback. However, as a doula, that doesn't tell me anything. And then usually the follow-up is like, -2. And I'm like, okay, your baby is actually not really low. Like, we're starting to engage, but like we're not really, I mean, we are engaged, but we're not like really low. And so we would focus a lot more on getting baby lower
Yes.
to apply that pressure. And what a lot of people don't know, again, every cervix is different,
Right.
but we could be 5 centimeters and that cervix could thin to 90%, and you could go from 5 to 10 in an hour or two.
Right.
Because once it's thin and that pressure is there, it just melts away. And so it really is like such a silly focus.
Yeah. Again, one piece.
In our opinion. Let's be clear about that.
Right.
I think it's good to mention. Hopefully, all that information was really helpful. But I think I want to focus one more time on consent.
Yeah.
Consent matters.
Yes.
Just because you consent to one cervical check does not mean you consent for them to come and do a cervical check whenever they desire.
Nope.
I mean, consent should always be there no matter what.
Right.
But for sure, when they're touching your body, your baby, all of those things. And they require clear explanation. You deserve to know, what is this going to look like? What is this going to feel like? What are we looking for? And you should, and everybody else in the room should be in agreement that there was full permission given. And even if you consent to a cervical check and you get in position and you have a contraction starting to build, there is no rush. There is no reason, unless there's like a medical emergency, there is no reason why that provider or that nurse needs to rush to do that cervical check unless it's an emergency. There should be patience to allow you to breathe and cope through that contraction, let it subside, and then move forward with that check.
Also, consent does not mean a nurse or provider walking into the room, sanitizing their hands, taking a look at you and saying, I'm going to check your cervix.
Mm-hmm.
So as a doula, I'm often being heard with my client, like, would you like her to ask you for consent for this cervical check? I mean, it's not hard, everybody. It's really not.
No,
make it a question.
You know, it's a little bit easier for us as the person who's not in labor and somebody who is familiar with this work and attend births on the daily. But that is a really intimidating place to be in when you are vulnerable and your emotions and your body is in a really raw state. You are entrusting your health and your baby's health in this provider, and they come in and they say, I'm going to check your cervix. You kind of feel like you don't even know you're being manipulated. Like you don't even know that consent isn't given because you're just like, you're trusting. And we're just here to tell you that that's not a question. And there should never be a statement made when it involves your body and your baby.
Yeah.
And it is absolutely okay, even if you have a close relationship with your provider, even if you respect them, if something in you is saying, no, I don't want that, you can respond and say, no, thank you. I'm not interested in a cervical check. That also goes for like, say you consent to a cervical check and the exam is happening and a contraction starts to build, or it just is extremely uncomfortable, or maybe there's a trigger happening in your body. Sure. If you say no, they should be taking their hands out of your vagina immediately.
I have been in situations where it hasn't happened, and it's really icky. Awful. And there's a lot of, oh, I'm almost done. Hang in there. I'm almost done. Right. Like, so there are just,
I need you to calm down.
I need you to calm down.
And take a deep breath.
Mm-hmm. Yeah. So that could be a whole other episode all on its own. So moving on.
I think too, kind of what follows that consent is talking about risks, right?
Yeah.
Everything in life comes with a risk. Any decision that we make in labor comes with risks. Mm-hmm. And so we just kind of want to break down what those risks are. And even though your medical provider may not consider these risks, we are here to tell you that they are, and they are things that you deserve to know about and that you deserve to have the information on in order to make the decision that's best for you. And that first risk is the discomfort, the pain. Cervical checks are not comfortable.
Right. They're not comfortable. And especially for those who have a posterior, if you're early on in labor and you have that posterior cervix, they have to get in there kind of far. And it is
back, like behind.
Yeah, it is uncomfortable. And so, yeah, like I think that's just a big part of it. Like it doesn't feel great.
And like if you have your 36, 37, 38-week visit and you leave and you're like, oh my gosh, that was so painful, you will likely feel your body respond at that next visit. And if you feel that, even if mentally you're not thinking, I don't want a cervical check, I want you to listen to your body. It is responding in a way for a reason. And that might be your moment to say, something in me does not feel right about this, or it's giving me anxiety to come now because I don't want to do that. Don't do it then.
Yeah, I agree with that.
During a cervical check in an office, if a client is extremely uncomfortable, language matters. And for a provider to make comments of like, oh, you think this is bad, just wait. Or, wow, you're extremely tight. I would be so surprised if your baby's going to fit through your pelvic floor, you know, with the tightness. It's like, oh, that's extremely encouraging. I can't wait to enter labor. Let me tell you, having a hand and fingers in your vagina is not a comparable pain to labor. So that language shouldn't even be a part of any of
conversation.
Those. Yeah. The other risk is an increase in infection, right? You're having somebody's hands in your body, and that risk only increases if your membranes have ruptured.
Right. Yep. And when your waters have broken, which again, I think that's another common conversation with providers is, you know, as soon as your water breaks, get in here because your risk of infection goes up, right? And as doulas and as just being educated, and there's research out there to back this as well, that truly, once your membranes have ruptured and your waters have released, there is a risk for infection because if we're getting cervical checks, that does mean that there are gloved hands in our vagina. And so really that's the biggest risk. If there's nothing going inside of your vagina, the risk of you getting an infection all on your own at your house
is pretty minimal.
Is pretty minimal. I actually joke a little bit with some of my clients. And when I talk about this, I usually turn to the partner and just say like, I mean, unless, you know, he or she are going to be doing at-home cervical checks and they're all like, oh my gosh,
never.
I know. So I'm like, okay, so it makes sense to you, right? Like it just makes sense.
And the only rule really is there's just no intercourse after your water's released. You know, if you're at home. And so, we just kind of break it down with our clients. We say like, what introduces infection to our body, right? Exterior situations, which would be like a hand, a finger, even if it's a gloved hand. It's still, every time we're getting that cervical check, we're increasing that risk. I already mentioned, obviously, just that emotional stress and pressure that can come with those cervical checks. But this is why we always talk about cervical checks during our prenatals. How do you feel about them? What are your thoughts on them? Do they align? And letting them know that A, consent should always be there, but B, they have absolutely an option to either have cervical checks or to not.
Right.
So just to give you guys some of that information that we have, you know, the conversations with our client on, how do you decide what's best for you? So some questions that you can ask yourself is, you know, when a cervical check is being offered, or if you're considering a cervical check, some questions to kind of go over is, how will this information change our plan? Is this required right now? Which we're here to tell you, no, it is not.
Nope.
And then a really great question.
I love this question.
What happens if we wait?
And pause. And we just pause. And I always am interested on what the answer is.
It is always like an interesting moment to see how information is phrased in that moment. Just know it is always okay to say no. It's always okay to delay and ask for time. And it's also always okay to ask for a different provider if you're feeling like you're not being heard and your wishes aren't being met.
Absolutely.
There's always a hospitalist on call in a hospital setting that can take over your care. So we are going to kind of end this episode with reframing choice in birth care. Choice is not about being difficult. It's about being informed. Cervical checks are a tool. They are not a rule. And parents deserve clarity, comfort, and respect.
Yeah. Cervical checks are optional. Feeling informed and respected should never be optional. You are always allowed to ask why. You are allowed to ask how this information will be used. And you are allowed to say no, not yet, or yes, based on whatever feels right for you and your baby.
Absolutely. Good care isn't about doing everything routinely. It's about doing what is appropriate, consensual, and supportive in that moment. I'm so glad that we recorded this episode. It is such an important topic. And we really hope that it has helped clarify something that you may be unsure about or that you were unsure about. If you feel like this was helpful, please share it with another parent who might be navigating these same questions. These conversations really matter.
They do, because confidence in birth doesn't come from knowing all the answers. It comes from knowing you have choices, your body, your birth, your decision, period.
All the time.
All the time.
We are so happy that you guys joined us for today's episode, and we look forward to the next.
Oh, don't forget to check out our links below. Check out the accompanying blog post.
Yes.
We'll also be linking some research and data points as well. Thanks for stopping by.
Yes, thank you. Bye-bye. Thank you so much for listening. For show notes, links, and more information, please visit our website at Mom2Mom.com. That's HOW2MOM.com.
And remember, whether you're a mom, a parent, or a caregiver, you are doing great. It's progress over perfection, and we're all just figuring it out together.